Hello, everyone. So for this assignment, I will be discussing the assessment questions that I will ask Mr. Trevor doing his biopsychosocial interview. And with these questions, I just wanted to gather like just more additional information just about all of his like presenting concerns and just his mental health problems and just all of the issues that he's been dealing with. So, um, to start off with the presenting problem, the first four questions I would ask for the presenting problem, I would ask him one about the fire. I would ask him if he could tell me about what happened the day of the fire. I would ask him for my second question. I would ask him what he was thinking and feeling before the fire started. Um, to get a better understanding of what would want to lead him to do something like that. What did setting the fire mean to him at that time? And I will also ask him, looking back, how does he feel about what happened? Um, these questions will really just get a better understanding of his perspective and just his motivation behind everything, and just his emotional state at the time, just surrounding um, the incident, and rather than just relying on other people's reports. Um, yeah. For the mental health symptoms, the four questions I would ask. I would ask him if he's ever seen things that other people could not see. I would also just ask him if he could tell me more about his experiences that he's had that others may not understand. Um, my third question, I would ask him how often does he like see and hear or feel things that other people don't. And for my fourth question, for the mental health symptoms, I would ask how does these experiences affect his daily life. I would ask these questions because it really would just get a better understanding of just the possible hallucinations that he has and just how they impact his overall functioning. For trauma history, I would ask him if anyone has ever hurt him in a physical, emotional, or sexual way. For my second question, I would ask him if he could tell me about any difficult or upsetting experiences that he's gone through in the past. Um, I would ask him about his relationship with his father for the third question, and how that has changed since he left. And for the fourth, I would ask him if he could tell me more about the neighbor that he mentioned during our interview. Um, and I would ask these questions because he did disclose some possible abuse that was happening. So I think just getting a better understanding of his trauma and just the past trauma, it will be essential to our treatment planning. Um, Safety and risk assessment. I would ask him if he's ever thought about hurting himself. Has he ever thought about hurting someone else? Um, for the second question. Third question, I would ask him like when he becomes overwhelmed, what is it that he usually does to help with that? And for the fourth, I would ask if he has ever felt like he's about to lose control, of his actions. And I would ask these questions because they really assess the risk to himself and the risk to others. And so that is when we can help identify some like more coping mechanisms. For family relationships, I would ask him if there are any like family members that he trusts and feels comfortable talking to mostly. For the first question, the second, I would ask how he would describe the relationship with his mother. Um, I would also even ask him about his sisters. What is life like at home with his sisters? Um, I would ask him who does he go to when he's in need of support. Those are my four questions for that. And I would ask him these questions because I feel like the family relationships, it can provide some very like important information just about his stressors, and about just his overall support systems. Social functioning, I would ask him if he has any friends in school or in the neighborhood that he lives. I would ask him how he usually tends to get along with other students. I would ask him to tell me about his experiences with bullying. And lastly, I would ask him what makes it difficult for him to keep friends. Because he seems to be very like socially isolated. And so I feel like understanding his relationship or his relationships with others or potential peers is important. As far as his educational functioning, I would ask him how are his grades in school? What subjects is it that he enjoys the most? I would ask him if these subjects, or no, I would ask him how his symptoms have affected his ability to focus in class. Um, and lastly, I would ask him how often do you complete assignments and attend school? And these questions will really just get a better understanding of how his symptoms affect his academic performance. For legal and behavioral history, I would ask him if he's ever been in trouble with the law prior to this incident happening. I would ask him if there have been other situations where he's acted impulsively. I would ask him how he responds when he's angry. And lastly, I would ask what has his experience with probation been like? Because these questions can really provide information just about his behavioral patterns and his legal involvement, and just get a clear understanding of both of those. For medical and substance use history, I would ask him if he's experienced any recent medical issues. I would also ask him if he's used alcohol or drugs. I'll ask him if he's taking any medications. And I would ask him if like how his sleep and his appetite and his energy levels, like how has that been as of recently? Because physical health and substance use, it can contribute to his mental health symptoms. Um, Strengths and supports. I will ask him like, what is it that he think he does well? I would ask him what is it that he's most proud of. I would ask him who supports and encourages him. And I would ask him what goals that he has for the future. And I feel like knowing more about his strengths, identifying those strengths, it will build better rapport, and it would definitely support the strengths based approach that I would have during my interview with him. Um, so, just overall, um, these questions would really help me gather a more complete understanding of who Trevor is, and just more of like his experiences, his symptoms, his relationships, whether it's with his peers or with his family, and just his overall strengths. And I feel like as social workers, it's very important that we move beyond those assumptions, and we have a chance to create more opportunities for clients to share their own perspectives, um, and really we just get more a clear understanding of who the client is in that moment and in the interviews. And so um, I would say that with the information that I would gather through my questions that I would ask Trevor, it would just give me more of like a guide, a guide for his diagnosis, and even for treatment planning, and see what connections or recommendations that I could find for him for future services. So um, that pretty much would definitely help with Trevor, and just give me a more clearer understanding of how to move with him as my client. So